Hello, this is Sohaila Rostami. I'm an oculofacial plastic surgeon, double board certified. We talked about the pre and post-op care for any kind of surgery. Also, I wanted to talk to you about surgical scars. Surgical scars, it's very individually dependent. So what it means that from one person to another, the surgical scars may look so different, even though the surgeon might use the same suture, same technique, and same instrument. We try to use a specific instruments for making the incision. There are so many studies using the CO2 laser to make the incision versus a scalpel, and there are different school of thought. Some people think that the healing process with the scalpel would be the better one compared to radio frequency incisions, CO2 lasers, and so many other instruments that we use to make the incisions. So anything that has heat involved in making the incision will not be appropriate for patients that form hypertrophic scars or keloids. Now, there are patients that do develop hypertrophic scars and keloids. And why do we create those kind of scars? It is multifactorial. Specifically, if you have family history of hypertrophic or keloid in your family, keloid formation in your family, or yourself in the past, that is the genetic background that you have, and is unfortunately hard to get rid of that genetic information and that family gift you got. So you have to be more careful and make sure you let the surgeon know that you do have a family history of hypertrophic scars or keloids in your family, or your history. So this is very important for the surgeon to know, because there are things that we can do during the surgery to prevent or decrease the possibility of formation of keloids and hypertrophic scars. We can treat the area with 5-FU or with steroids to decrease the formation of the keloid when you're healing. And also during the healing process, we can do those injections to make sure that the hypertrophic scars are not forming. The other thing that we can do, if the body is not responding to 5-FU or steroid treatment injections, we can use silicone gels. These are also helpful, but beyond that is radiation treatment for keloids. That's when really is severe and is not responding to any other treatment. So hypertrophic scars can be problematic for patients, and it's so important to give that history to your surgeon, and the surgeon should be aware of it so they can pre-treat and predict what to do for you during and after the surgery. I hope this is helpful.